Okay. If we could have everybody mute until the question and answer period, that'd be great.
Okay, can everyone hear me? Yes? Okay. Thank you for joining tonight. It's Thursday night, 7 o'clock. It's an interesting hour to get on to a webinar, but I appreciate everyone's participation tonight and for showing up. My name is Dr. Suparna Mahalaha. I am an assistant professor at the Case School of Dental Medicine, and I'm in the Department of Community Dentistry. I've been a public health dentist, focusing in the public health sector and the academic sector for the past 20 years. And tonight's session is going to be talking about dental care for children and adults with Down syndrome. And I will share my email address afterwards. If there's any questions, we can, take this conversation further as needed. And of course, I'll also share my cell phone number with you all too. I don't know why my slide's not advancing, sorry. All right, so I want to first thank you. Thanks to all the caregivers out there, and thank you for showing up tonight on a 7 p.m. Your loved one is lucky to have you in their lives, and vice versa. And also, don't forget to take some time for you. I'm a parent. We've had challenges in our household, and sometimes we forget to take care of ourselves. So please do that as well for you. I like to include this slide because I want you to think about your face, okay? The lower third of your face, and think about the last time you laughed aloud. Think about the last meal you enjoyed. Think about the last time you had a great, excuse me one second. I was telling Dr. Sifra before we started, I'm in a public space, so I'm sorry if there's some background noise. Okay, so think about the last meal you enjoyed. Think about the last time you had a great conversation with someone, how you smiled to convey kindness or friendliness. You can do all those things without optimal oral health, but it does make it easier if you do. So again, I include this to have you think about how oral health is so important for your overall health and well-being as well for us all. I like to just talk about, what is oral health? It's not necessarily just the absence of disease. It's the presence of oral wellness, which is healthy teeth, gums, tongue, the ability to smile with confidence, to speak and to chew and enjoy all kinds of different kinds of foods. I like to include the schematic of the tooth, the cross-section of a tooth. Again, just for knowledge, we have 3 layers of the tooth: enamel, dentin, and pulp. What you see in your mouth is your crown. And what you don't see in your mouth is the root below the surface of the bone and the gums.
I dropped it.
Somebody wants to mute, please. Okay, so there's the 3 layers of the tooth, and I want to include this as well. So when you have a cavity, that cavity can start in the enamel, but if it goes further into the dentin, that's the area that's very sensitive. It gets into the pulp, and that's when you need a root canal and a crown. So I guess the point of this slide is to say, it's preventable. If you get a cavity in that first layer and you get it taken care of, either with a filling or a medicine we can apply onto that surface to stop the cavity, it never has to get to something a little bit more advanced. And as all of you know, dental care can be a challenge in the Down syndrome population, and I'm probably not telling you anything you don't already know. But there's features that are present at birth, lack of access to proper dental care, and also finding dental providers who are available to treat, and also the wait times to get into some of these places if you can find a dentist. Dependency on caregiver to assist with the daily oral hygiene, that can be challenging on a daily basis. Low tone in the face can impact breastfeeding, swallowing, chewing, and speaking. Protrusion of the tongue and lower jaw may lead to open mouth breathing, which is associated with dental infections and increased drooling. Common dental habits, and I'm sure you've observed some of these as well. Bruxism's a big one, tooth grinding and clenching, infrequent toothbrushing, infrequent dental visits, pocketing of food in the cheeks while eating, and pica, which is a condition, where persons ingest or mouth non-edible items. The different reasons for why someone might not want to brush their teeth twice a day. The sensory overload of that, such as disliking the feeling of the toothbrush in the mouth or the smell, the taste, the texture of the toothpaste, gagging during toothbrushing or tongue brushing, bleeding gums, which could be due to poor brushing technique, brush type, or sensitive gums. That can also be a sign of gum disease. And, I often hear people sometimes say, well, I don't want to brush their teeth because they bleed so much. Well, they're bleeding because they're dirty. Gums don't want to be, full of debris. So they react by becoming inflamed and then they bleed. So when people say, I'm just not going to brush, but you're making the situation worse if you don't. So it almost has to get worse before it gets better. You have to kind of get through the bleed and then it'll stop bleeding when it gets clean. Hygiene is, we talk about this also because it's such an easy way to prevent, and it's also difficult. I understand that too, So the standard is we attempt to brush the teeth, floss, and brush tongue twice a day for 2 minutes a day, and that's for everyone. We want to use fluoride toothpaste and a fluoride rinse or a fluoride rinse. If your loved one has dry mouth, you can also use different products for those as well. There's gels, there's sprays, there's rinses. Important to keep the mouth hydrated because saliva actually is protective against decay as well, and also keeps the tissues of the mouth healthy. You can consider using a 3-sided toothbrush if you don't have a lot of time to get in and out of the mouth, or you can use an electric toothbrush. So I have a 3-sided toothbrush. I hope you guys can see this. So it has on either side and on the top. Okay, this is my typodont, so we call it a tooth model. So have your person who you're helping open, you'll want to take this brush and put it right on the top of the tooth table. Okay, this way you're going to get the surfaces on the inside of the tooth, the top of the tooth, and the outside of the tooth in one stroke. Okay, this can go this way and that way. Another thing you might want to do if you're helping someone brush is you can pull the cheek out if you're worried about getting bit. So you never want to keep your fingers on we call this the occlusal table, the top of the teeth. You don't want to keep your fingers here. You want to pull the cheeks out, okay? And then get your brush in and protect your fingers and get onto these surfaces of the tooth here. I hope you guys can see that. One other tip I'd like to mention is when you're helping someone brush their teeth, don't have them open really, really wide for those back teeth, because it's really hard to get the brush back there if the muscles of the face are collapsed over those teeth. So if you have the person you're helping close gently, you can then pull the cheek out and get that brush to the back to get those teeth in the back. Otherwise, it's hard to get for that toothbrush to get back there when the muscles are, right up against the teeth. You can use a flosser with a handle. You can use a mouth prop to hold the mouth open if that's tolerable. If chewing gum is an option, a sugar-free gum with xylitol, and there's different products out there, Spree, Epic, Trident, Mentos. They're the best because they have xylitol, and that's what xylitol does is it inhibits the growth of cavity-causing bacteria, which is called strep mutans. And this gum chewing and the production of saliva will keep the teeth clean and kind of cleansed throughout the day. Apply lip balm to prevent dry lips and cracking as well. Diet, this is a tough one too, for all of us, I'm sure. I know it is for me. You want to avoid excessive sweets, refined carbohydrates, and medicines. The gummy vitamins are a real culprit of decay as well, because that sticky, gummy sits in the grooves of the tooth and it doesn't wash away. That sugar just stays there the whole time. And that contains a lot of sugar. You want to encourage your loved one to drink water more often, limit sweetened beverages such as soda pop, energy drinks, and juice. If your loved one is going to drink some of these drinks and things, you can always ask that you swish out with water right after, like a water chaser. So you never let sugar stay on the teeth, then you can prevent the decay process from even starting. A real quick swish of water sometimes helps a lot too. These are easy things to say, they're hard to do sometimes. But prevention is truly the best strategy because most oral health conditions can be prevented. So there's the three big conditions that affect a person with Down syndrome: periodontitis, periodontal disease, which occurs when there's an infection and inflammation of the gums and bone around the teeth. And this is often caused by plaque buildup that does irritate the gums. A milder form of periodontal disease is gingivitis, which just affects the gum around the base of the teeth. The difference is in periodontal disease, it affects the gum and the bone, and the bones will hold the teeth steady. So when that starts to move, then the teeth start to move. We don't want that to happen. However, gingivitis is something we can treat because it's just only in the gum part of that tooth, not the bone yet. And again, good dental hygiene habits can prevent both of these conditions. I like to spend some time talking about cavities. This is the number 2 common condition. We call it dental caries. This damage to the tooth that can happen when disease-causing bacteria in your mouth make acids that attack the tooth surface or the enamel. So you think about the bacteria if they're in your mouth, strep mutans, and then you're eating or drinking something, and there's sugars and carbohydrates in your food. And if that gets left on the tooth surface, these bacteria will feed on that sugar and carb, right? The bacteria waste product is acidic. That acid sits on your teeth and then it starts to melt the enamel. So this can then lead to a small hole in the tooth, which is called a cavity. And if that decay is not treated, it just keeps going down those 3 layers we talked about, right? So if you can stop that process from happening in the beginning, it never has to progress. And then bruxism, grinding and clenching of the teeth. This can be during the day or the night. And it's caused by behavioral, harmless repetitive habits, psychosocial, anatomical, or sleep position concerns. And these can be related to stress, anxiety, sleep-related disorders such as sleep apnea. And unfortunately, bruxism can lead to changes in tooth shape, tooth fracture. You can get headaches, jaw pain. So it's definitely something hard to manage, but there are ways to manage it. You can reduce stressors and promote a relaxing nighttime routine. Head, neck, or jaw massage to relieve muscle pain. You can apply a warm compress. You can make one of these at home, get an old clean sock, fill it up with rice, and you can put that in the microwave and heat it up, and you can apply it right on the areas, and it'll lay right on the neck or the jaw or the head where there's pain. Avoid hard to chew foods before bedtime, so you're not stressing those muscles before going to bed. You can use additional or structural pillows for appropriate head and neck support. You can practice mouth exercise from the Sleep Foundation, and I've included this website here, and we'll make this presentation available to everyone as well. Dental mouth guards and other devices can also help with bruxism. There's a lot of information on this page, and this is the resource page. So that first toothbrush I talked to you about, you can look at that on specializedcare.com. I don't get any royalties from this. It's just a product that I like to use. And you can order toothbrushes like that. I think you can also get them on Amazon too. And there's different videos on that particular website on tips on how to brush someone's teeth. Special Care Dentistry Association and the American Academy of Developmental Medicine and Dentistry are both 2 great organizations that advocate and teach. And, I'm a member of the Special Care Dentistry Association myself. These are organizations that focus on people with intellectual and developmental disabilities, frail older adults, those who are medically compromised, and they take a really an interdisciplinary approach for the treatment and access to care and advocacy issues for these populations. Check out their websites. They have some great resources there as well. Before this talk, I did call around to some of the bigger hospitals here in town. I'm sure all of you may be familiar already. So if your loved one is someone who can, go to a traditional dental office and be seen by a pediatric dentist or a general dentist, there's many wonderful dentists who do this kind of work. And I can help connect you if you're looking for somebody in the private sector. Now, there's also instances where, your loved one might need to be in a hospital setting or need sedation. This is really a tough time, after COVID. A lot of the ORs are booked and people are getting kicked out of OR slots. But I did call at UH, the pediatric dental practice there. I was told by the director just 2 days ago that it's a 4-month wait for the consult right now and another 7 months for OR time if needed. And this is for patients under the age of 21. Now, if it's an urgent matter, swelling, pain, bleeding, those kinds of things, trouble swallowing. You can ask to speak to the pediatric dental on-call resident, and you can do a phone triage, and maybe they can get you in a little bit sooner. There's the information there as well. I called over at Metro Hospital. The director there said, their OR time is pretty long. It's 18 months. However, they are starting an in-office sedation for appointments this fall. So he couldn't give any more information other than stay tuned, but you might want to keep checking back. And if I hear anything, I can certainly share with Dr. Sifferbean as well. The Cleveland Clinic Dental Practice, as per the website, and I do know the director there, they do work on adults and children who need sedation. Call the number there and see if you can get in. I know their times are a little bit delayed as well, but I don't know for sure. There's another place in town called Cleveland Children's Surgery Center. Blue Cloud, I believe, is the company. They used to only see children, but now they also see adults with special needs and those who need sedation. So check them out as well. I don't know their wait times, but I know that they are a new resource in town and do take most insurances and CareSource and Medicaid. So I know that was really quick. I wanted to spend more time actually hearing from you and figuring out what your challenges are, what your access to care issues are, if you have any other questions. Everything I prepared from this presentation are from these resources on the side here. Mass General Hospital, they have a Down syndrome program, NIDCR, and I'm a clinical director for Special Olympics and the Special Smiles program. So I've used some of their information as well to share with you. Does anybody have any questions? And I hope we can open up now and speak freely.
Yes, let me stop the recording.